you have started your first professional, and the first subject, lo and behold, you go to is anatomy. And anatomy takes you to the dissection hall, where you are, analyzing and learning human anatomy through cadavers. And anatomy is a very essential subject, important subject, in which you will study the from top to bottom. If I take it from head and neck, the brain, skull, what we say in computers, the hardware. So the hardware of the human body you are studying. And from the upper limb, lower limb, the various systems, all the organizational structure you are studying. And anatomy, in a sense, I would say that quick learning points are that, your DH sessions, the dissection hall sessions, are very critical. Again, I would say linking the theory and the practical part of it is the foundation, because when you do surgery in the final year, when you study surgery in the final year, your concepts of anatomy will come into action. Then again, in anatomy, we have tissue structure study, which we call as histology. It's a subject of anatomy that is important, comes into pathology, very applications in pathology, which you will be studying in the second prof. Now, coming from the 11th and 12th, in 11th and 12th classes, when you're in the K-12 level, you're also studying the anatomy of the human body to a certain level, wherein the respiratory system, say, the two lungs and, the trachea and how the various, in that, the anatomy physiology is interlinked. So this first year is very important from the student's point of view to really enjoy and learn the human anatomy from the structural part of view and visualization. I would urge the students to, learn through the actual bones, how you are going to study the various veins and the nerves. Everything is interlinked.
This is more of a foundational program,
Yes,
and we will be talking more about how to study anatomy in the medical art dedicated to that.
correct.
But just to give some popular interest, if you have seen Doctor Good Doctor, the eminent surgeon out here has all the human anatomy embedded into his brain structure, the 3D holograms which are projected. He finds a way out of it for surgery. So this foundational program has to be really immersed upon. And even being a GP, if you are really seeing it from a consulting perspective, a thorough knowledge of anatomy is really helpful, because a very, very finely trained physician, without using much of the gadgets and instruments, if his or her anatomical knowledge is strong, they can
Yes,
really land up at an accurate diagnosis with just a ziffy, as we can call it. Yeah.
absolutely. So
Moving
coming
forward.
to the next subject, we have physiology. Physiology, of course, talks about the dynamic systems of the body, how they are functioning, the various organ systems. Physiology takes you from sleep disorders to, to understand circulatory system to nephrology. Everything has the basis in physiology. And friends, when you're studying physiology, it's important, again, I would say, the science of visualization. When you're studying the optic eye system, how the eye functions.
So,
In
Doctor, what is the difference between anatomy and physiology? Kindly explain that.
Definitely. Anatomy as a subject talks about the body structure. It just talks about the body structures in detail, wherein, like, we are studying the bones, the arteries, the veins, what are the nerve plexuses which are serving the body, but it does not tell the interplay, how the life, the motion, the dynamics, how the functioning is happening comes in physiology. So it's like if you have a computer, the hardware is anatomy, and the programs which are learning the functioning entire from the CPU-ROM, the processor, how it is all functioning is the life of the system is physiology.